The quality of care that these patients receive is as good as they can get anywhere.
We see an assortment of patients. Primarily, we see three big diseases that have a major impact on the health of those people and the community around them: high blood pressure, diabetes, and chronic obstructive pulmonary disease. Those three diseases account for a significant amount of the illness in our community, and they have a rollover. For example, diabetes and hypertension have a major role in creating heart disease. So you control those, you cut down the incidence and severity of heart disease.
When I go to the clinic, it's the nurses, the doctors, they're very nice. They're always there if you need something. Dr. Menifee got my insulin, where it needed to be, and he pretty much saved my life, so.
I've been employed with the company for going on 20th anniversary, going on 20 years, and the company cut back this past June, made 2 years that the company cut back to the point where I was working part-time. I'd lost all my benefits and my insurance. Because of Alabama Free Clinic, I now have access to a doctor. I now have access to my 4 prescriptions that I have to take daily. Without that, my treatment regimen would not exist. It's just that simple. I can only do so much on my own.
Alabama Free Clinic, when I went there, I was in a wheelchair. And at that time, I had no help with my insurance, nor meds. And they helped me to get meds, and as well to get to doctors to monitor me while I take those meds. And with the blood pressure and the diabetes.
If you are a healthcare provider and you got into that field because of the goal of helping people, which most of us did, and you want to get past the stuff, and that's a nice word I can say, the stuff that interferes with your ability to really take care of people, this is a great place. You do what you were trained to do. You do what you've always wanted to do, knowing that many of them, without us, are not going to get the care they need.
These are patients that fall between the cracks. They do not qualify for Medicaid. They do not qualify for Medicare. They cannot afford insurance. And most of these patients are hard-working people. And they deserve the same quality of medical care that all of us do.
It would be hard without the Alabama Free Clinic because I don't know how I would get my medication, and I need to take care of my children. I need my health to stay good. I really don't know what I would do. It would be very hard.
And it's a lifeline to me. It truly is a lifeline. And I don't know what I would do without them.
I appreciate your time and your commitment. That means the world to me. It's an invaluable thing to have access to. Thank you, Alabama Free Clinic.